What is PCOS?
It is Polycystic Ovarian Syndrome.
Okay.
And
what does that mean?
With that, so
I know what ovaries are.
Yeah. So basically, as the name implies, at some point, cysts on the ovaries come into play.
Poly meaning many, cystic meaning cysts.
Yes.
So many cysts on the ovaries.
Yes. So at some point during the process of a female generating eggs, or folliculogenesis, I believe it's called, something
I'll take your word for it. I don't know.
Something goes amiss, which we'll talk about. And so instead of a mature egg ending up where it's supposed to, you have these like they're like premature egg follicle type things that then resemble cysts on the ovaries.
Okay. All right.
So and again, that's just if we're just looking plainly at the name, sort of.
And what's the consequence of it? I mean, my understanding is it's pretty significantly painful. Mm-hmm. How often does this happen?
What's mostly seen, and it's technically a syndrome. Syndrome basically just means it's a group of symptoms that are occurring together, which becomes a little bit different than, hey, my cholesterol is supposed to be this number and I'm over that number, I have high cholesterol. Syndrome can be a little more nebulous, a little more spectrum-like overall. But this one really is linked to missed and irregular periods. Also facial hair growth. Essentially, there's too high of testosterone. There's an elevated level of androgens that can lead to that male pattern facial hair growth. Some acne issues, again, coming from those excess androgens. Infertility, and also issues with insulin resistance. There's a huge link with weight and insulin resistance going into not even full-blown diabetes per se, but that insulin resistance.
That's what triggered me to segue to this was I had seen some interesting articles talking about a link between those two. So what do we know? Why is it do we know why there's a link between, or what the link is?
Don't know. There's definitely different schools of thoughts about the chicken or the egg with it.
Okay.
Because there's a cascade here that's I found really helpful, that elevated insulin leads to insulin resistance, which leads to elevated, like Dante was saying, LH and FSH, follicle stimulating hormone, and then you get the polycystic ovaries.
So hold that up,
and then it links to high testosterone.
This is literally why you get paid the big bucks, because I would not be able to follow that. But what you're saying is it kind of just, it goes all over the place and it can come from either direction.
Yes, when your insulin is high, then it increases the LH and FSH, which are basically precursors to hormones. But polycystic ovaries and then elevated testosterone.
Chicken and the egg, because it could go either way, and we're not really sure what it is.
Yes. The other, because there's a lot of data that's showing that this is very prevalent in adolescents. And a lot of very few adolescents, even nowadays it's getting worse, but there's less obesity and weight issues and insulin resistant issues in adolescents compared with middle-aged women. So you're seeing this in a lot of adolescents with the irregular periods and the acne and the increased androgens, but you're not seeing the insulin resistance. And that goes back to the whole thing about being a syndrome and being a little bit of a spectrum, that it is complicated in that sense.
It's not like you caught it. It's not a disease state that you have.
Exactly.
It's a set of symptoms. What's causing these symptoms? We're not.
Sure. And don't get me wrong. Sometimes you match them up perfectly and there's no doubt you have it. I'm just saying it can, when you're talking about a syndrome, it becomes a little more nebulous at times.
Okay.
Mm-hmm. And the problem is there's genetic factors, there's environmental factors, there's, obviously lifestyle, and then obesity, which is a massive contributor. So it's always multifactorial.
So, and it bears discussion as well. Diabetes, we discuss typically two types of diabetes, type 1 and type 2. Type 1 is genetic. There's nothing you can do about it. You've got it. Mm-hmm. Now learn to live with it, whether it's through insulin injections or is type 1 always insulin injections?
You will have to replace the insulin that
eventually
you're unable to produce. Yes.
Yeah.
Type 2 is based on lifestyle and diet, correct?
Generally, yes.
And so it's to some extent something you've done to yourself.
Yeah.
Is that a way of saying
time,
that? I mean, not to be mean, but
there's genetic components, but yes, over time, yeah, it is.
Okay. So there is a link between, is it type 1 or type 2 diabetes and PCOS, or is it both?
Both.
Okay.
Both. So there's
Interesting.
a very high prevalence of PCOS in type 1 diabetics.
Okay.
So I think that just further kind of contributes to no pun intended, the chicken or the egg kind of thing.
Right.
You know?
Because it is in both. We're not. Okay. All right. So assuming you're in type 2 diabetes, will losing weight and controlling your diet reduce or eliminate the PCOS?
It can. So you can never technically cure PCOS because again, because
it's not a disease state. It's not a thing that can be cured.
Not that that really matters. That yes, with lifestyle changes, if you can get essentially blood glucose under control and become resensitized to insulin, then based upon what Joey said, then the hyperandrogenism symptoms and all that stuff can then be reduced as well because there's such a tight interplay. But it's way easier said than done.
Yeah, it goes back to it being a syndrome that essentially if you have 3 of these symptoms and you reduce the impact of all of those symptoms, you may still technically have the syndrome because you have to actively treat those symptoms.
Right.
But the manifestation of it, if your periods have regulated and you're more sensitive to insulin, your weight's gone down, and you've dealt with some of the facial hair growth and acne.
Yeah, if it doesn't look like it anymore, if you're not experiencing the symptoms, then it's controlled, but you need to continue to do the things that are helping to control it. You can't say I'm done and I'm good.
Yes, and then it's back to the chicken or egg thing. If your PCOS was really generated by insulin resistance and you got it maybe in your 20s or maybe you are an overweight teen, etc.
Right.
And it just follows that pattern, then maybe it is a little easier to unwind because you have a clear cause. If it's more of the hormonal cause,
right,
like it's formed in adolescence and you don't have insulin resistant issues, but you still have these irregular periods and you still have this acne, then essentially it could be a little harder to cure or unwind.
So for somebody who hasn't been diagnosed or realized that this was even a thing, the symptoms are, the signs to look for are irregular periods,
yes,
facial hair growth, bad acne, and was there anything else, or are those the primary ones?
So I guess if you could even put those back into like 3 bigger buckets.
Yeah.
So there was the whole like hormonal imbalance, which would then encompass things like irregular periods and such.
Right.
The second bucket would be insulin resistance.
Okay.
So if you're noticing something's maybe off with your blood sugar or you've had high blood sugar readings, that's another one. And then the other one, based upon the signs and symptoms of the acne and the facial hair, you can just lump into hyperandrogenism. So high testosterone, basically.
Okay. It's multiple things that could be all affecting and leading. That's terribly said.
No, I mean, so then when you look at those 3 categories, that's like the easiest way to then outline how and why it's treated.
So if somebody is experiencing those things and doesn't know why, and other than annoyance primarily. I mean, it's not deleterious to your health to have facial hair or acne, but the PCOS can have very, very painful side effects as well, right? Like the cysts rupture or something like that.
Cysts themselves can. Yeah. Other times they are benign and go away.
Okay.
But yeah, that's a possibility. Yes. But usually what you're dealing with is the weight, is the hyperandrogenicity and the anovulation.
Those are the signs.
Those are the major
of what's going on.
And then ultimately you're a little more concerned about things like endometrial cancer, cardiovascular disease.
Okay.
That whole umbrella of things as well.
Yeah, you're more likely to have those symptoms and go in and get checked and they find cysts on your ovaries than the other way, typically.
Wow.
And then just physically, obviously, complications with pregnancy and fertility. So it
does affect all that as well.
Yes.
Yeah, I guess so. That makes sense.
That's ultimately why.
Anytime your periods are off, infertility becomes an issue. So that only applies to
sure
where it's desirable, but obviously if that's occurring to you, that's
the thing to look for.
Yeah.
And it is relatively common. The article I was reading was talking about 5 to 10% of U.S. women, about 5 million women are dealing with some level of PCOS. That's not That's a lot of people.
It is.
That's a lot of people.
Yeah, I think as generally in society, there's more of an issue with obesity and weight. There's also more environmental exposures. I found a study that showed that they found elevated bisphenol A levels in women with PCOS.
Okay.
So bisphenol A is found in plastics. It hardens plastics.
Oh.
Water bottles. It's basically everywhere. It can be an endocrine disruptor. It can essentially increase estrogen in women and disrupt their hormones.
Cool.
So.
Brilliant. Love it.
They found that environmental link too. So there's a lot of these things. It's a big puzzle.
So
sure.
What are the treatments if somebody is dealing with this? Lose weight, regulate blood sugar. Is there anything else?
Yeah. I mean, so the big categories would be like you'll see oral contraceptives being used because of the estrogen and the progesterone components.
So that helps level them out.
Yes. Because ultimately you're seeing an imbalance for most of these females is too high of testosterone. So
right.
in some fashion, your goal is to correct that.
Got it.
And then the other categories would be anti-androgens for the same reasons we mentioned, insulin sensitizers, metformin, which is a very common diabetic medication. There's another class of diabetic medications that are used. And then there's also, if you're looking more specifically at fertility related issues, there's actual ovulation inducing agents.
Okay. So
it's beyond helpless. It's beyond not helpless.
There are
yes,
there's hope. You can do things.
Yes.
So, and you wouldn't do all of these things necessarily. It would be based on what your situation is and talking to your doctor and all of that.
Yes.
Now, my understanding, I know metformin is a very old drug that has very few side effects. It's very consistent. It's very cheap. It's a good drug as far as those things are concerned.
It is. It's shown to work. Yes.
So that's cool. I know there's been a lot of question recently about hormonal birth control and its, what would we say? How good it is to take overall. And it sounds like in this situation, it's probably better than the alternative.
Absolutely.
Okay.
Yeah, it depends where you are. And then I think that's where depends how deep you want to dive into it. There are other things you can do to get your hormones tested. There are natural hormones that you can do. You can take progesterone to help balance out that estrogen, especially if you're working on lowering the testosterone. There's a drug like spironolactone that helps to do that. So there are other things you can do that's a little more difficult. You've got to
engage.
It's customized. You've got to engage. Good way to put it. Then simple birth control, and it's going to work, and it's going to be right where it says it's going to be on those days.
Right.
But there are other avenues you can go to if you don't want to go the birth control route. But you've got to get the cycles regulated.
Makes sense. And, and the easiest thing, the thing that we can all do is quit eating so much sugar, regulate that blood sugar, lose weight, exercise, do some of those basics, and that should help some of these symptoms.
Yes.
Okay. Well, that makes sense.